It's been hard. I was born with asthma. I was diagnosed with asthma at 6 months in Chicago, Illinois. So I was on every inhaler it was. I was also on Theodon. I ended up being on a nebulizer machine where I take 3 times a day. So when I would go to school, I would have a machine at home, a machine at school. So my asthma was like it wasn't getting no better.
Bredetta has had difficult to control asthma for quite some time. One of our challenges as physicians in the clinic is that we're only able to spend about 15 to 20 minutes with each patient. It's difficult to get a sense of what their home environment is really like and what triggers may be playing a role in their asthma.
I finally made an appointment with Dr. Pressburg, and he had a new partner, Dr. Zane, and he introduced me to this program that I'm in now. And he asked me, was I interested in it? And I was like, yeah, because, yeah, I do need to know why I keep having the asthma attacks out of a sudden back to back.
Fam Cares is Fight Asthma Milwaukee's home visiting program, and it's specifically for people between the ages of 2 and 40 who have uncontrolled asthma. So they're making frequent visits to the hospital or using their emergency inhaler way more than they should be. So there are 6 visits in total to the home. The first 3 revolve around asthma education, so understanding your medicines and how to use them properly, and we talk about triggers. And then the second half of it, so the last 3 visits, are the environmental portion, and we talk about green cleaning and not to use the harsh chemicals, and then we provide them with a green cleaning kit and show them how to do it right there. And then we do the room-to-room visits with them in their home and help them figure out how to identify the triggers that are making their asthma flare up.
Each house I moved into is always something wrong with it. Roaches, they sets me off. They does. Because when they come out and they spray, even though they tell you stay gone for 4 hours, my asthma flares up. Mold, like the house I'm in now. The mold was so bad here. I don't know how many times. I can't even count how many times I went to the house.
She passed her pre-test with flying colors. So did her daughter. So it was very obvious to me that she had been to the doctor multiple times for her asthma and that they gave her the whole spiel and that she already understood it all. One of the concerns was that Bredetta was using cleaning products like bleach, which are really bad for asthma. And so then after talking to her about green cleaning, her and her kids started using them. Her 2 twin daughters were super into it, which is cool. There was a leak in the kitchen sink creating problems and mold issues and some evidence of pests. These were things that were bigger than her. Her landlord needed to do his job, and she was suffering the consequences of that.
Marisa came in and we talked about the different triggers. She would bring like different things. Each time she came, she brought something new to the house. Like I never knew you could clean up with vinegar, the tea oil, and water. She said it's an old remedy, and ever since I've been cleaning with that, my eyes I could breathe a lot better. Cause using all these different chemicals like the Fabuloso, I would have trouble breathing. It's like it'll take my breath away.
Every physician wants their patients to improve. By referring our patients to a program like FAM, it also demonstrates to our patients that we're committed in using all the tools at our disposal in improving optimal health outcomes.